About 60% of all congenital diaphragmatic hernias occur as an isolated finding. The presence of findings such as rotation of the gut and pulmonary hypoplasia are due to the consequences of having abdominal contents herniated into the chest and considered part of the CDH process. However, the remaining 40% of the time, congenital diaphragmatic hernia is considered non-isolated and is associated with other malformations. The most commonly associated abnormalities are those of the heart, followed by the bony areas of the chest and spine, the central nervous system, limbs, abdominal wall, and the kidneys. Therefore, the first step in the evaluation of a baby with a congenital diaphragmatic hernia involves a comprehensive evaluation of all of the organs on an ultrasound. Because the main damaging effect the hernia has is on the amount of lung tissue in the fetal chest, part of this comprehensive evaluation focuses on assessing lung volumes. If the CDH is isolated, the extent of pulmonary hypoplasia is the most important indicator of postnatal prognosis. For this reason, measurements such as the lung-head ratio, or LHR, are obtained to calculate lung volumes. A fetal magnetic resonance image, or MRI, is offered as part of the evaluation for additional visualization of lung tissue to again assist with counseling and prediction of survival. Because of the associated abnormalities, a specialized ultrasound of the heart, or a fetal echocardiogram, is offered in order to further visualize detailed cardiac structures and function. In addition to the commonly associated structural abnormalities, 10 to 20% of babies with congenital diaphragmatic hernias have associated chromosome abnormalities, including trisomy 21, trisomy 18, and trisomy 13. Thus, amniocentesis is offered to our patients during this evaluation process. Diaphragmatic hernias are also known to be associated with certain non-chromosomal genetic syndromes. Therefore, we recommend a consultation with our genetic counselor where a detailed family history, as well as the pros and cons of performing an amniocentesis to evaluate the fetal karyotype, will be discussed. Amniocentesis involves removing a small amount of the amniotic fluid around the baby and sending it to a laboratory for evaluation of fetal chromosomes. After this initial evaluation, which includes the detailed ultrasound, consultation, and possibly amniocentesis, the next step involves obtaining serial ultrasounds every 4 weeks to follow fetal growth. These ultrasounds not only assess appropriate interval growth of the baby, but they also evaluate the hernia and any changes that may have occurred over the past few weeks.